All right, so welcome back to episode 2 of the Kinometrix, maybe Kinometrix podcast. Still haven't decided on the name, but that's okay because the first episode's not even out yet, so we still got time to fix that in post, as they say in Hollywood. We're back here today with Patrick. Want to say hello to our adoring fans?
Hey, everyone. Thanks for having me, Brian.
All right. So last week we talked about the creation of Kinometrix, the idea behind it, all the good that's going to bring into the world. But this time around, we want to talk specifically about Patrick, his founding, and what good he's brought into the world, and exactly what led him into this spot right here. So why don't we start from what everyone wants to know? How did you get into the healthcare space in general? Did you imagine yourself as working as a nurse as a youngster, or how did you get into that?
Oh man, that is a question. I don't know. I can't honestly say that I picture myself as a nurse as a youngster for sure. I for all the men out there, I can honestly say that we still have a challenge of nursing being seen as a very female profession, and sometimes it's not as accepted or it's not even promoted to you. I can honestly say that even when I was looking for a nursing school and had decided that's what I wanted to do, I had advisors at universities try to talk me out of it and try to send me into what they thought was going to be the next latest and greatest healthcare oriented profession, just not nurse. And I'm not going to say that was because I'm a man or not. It's just what it is. You just made me. I actually completely forgot about that until you asked me this question. So I
Sure.
think
Why don't we dive into that a little bit? Actually, like what happened there? I'm honestly very curious, like what these conversations sound like.
yeah, honestly, I went to would go to a university that had healthcare programs plural, and I'm not sure, maybe it's because the nursing programs had wait lists, or maybe there were some other factors of what they thought people might be more inclined to be want to do. But I was nudged. I'm not gonna say pushed at all. I was nudged toward considering uh, a cardiac invasive technologist, so someone that would specialize working in a cardiac cath lab. Interestingly, that those professionals work very closely with nurses, so it's not like I couldn't work in a cath lab as a nurse. And I think that's another conversation, is how wonderful nursing is from a breadth of what you can do, or nudge me towards respiratory therapy or physical therapy or things like that. But by that point in my life, I had determined that I wanted to be a nurse, and nursing was what I wanted to do. I had actually started working in a hospital as a transporter. So that was now we're circling back. So that was my first healthcare role. I was a transporter in a hospital, pushed patients to and from radiology exams primarily. And I did that. I left a job I had had for a couple of years in the sales field, um, so I could get a sense of who did what in a hospital, really, just ignoring what's shown on TV and things like that, and determine what it was in that space I wanted to do. So fortunately, having had that brief experience, or I'd done that for about a year at that point, I knew that nursing was what I wanted to do. And I think part of that is because nursing is so broad, that I felt like it wouldn't pigeonhole me. I wouldn't just be able to work in a cath lab or in one setting. No offense and no disrespect at all to any of those professionals. Love them dearly. Great colleagues of mine I've worked with have those roles. They're meant for it. It's meant for them. I'm a nurse, and that is, I can say that confidently now, having over 10 years later. Well, actually, from starting nursing school now, we're only like 15 years later. So, yeah, that's kind of what brought me to healthcare. Now, what brought me into this world of artificial intelligence is a very different conversation. Not that different, but definitely wasn't planned at all.
Yeah, definitely. We're definitely gonna try to get into that because most people don't really assume that healthcare goes directly into the artificial intelligence, machine learning side of things. But I want to stick with the kind of this part right here so we can really understand like what happened. So you mentioned something interesting. You said that you're working in sales for a little bit. So did you graduate from your undergrad and then get into sales before you went to nursing school?
Before I went to nursing school, yeah, I had done saw a couple years in college, realized I was in the wrong school, wrong program, wasn't for me, left that behind, decide I'm just going to go get a job, which for all those out there contemplating taking out student loans and things like that, because it's, you think you have to, trust me, try to avoid student loans, at all, if at all possible, which obviously in today's world, it's not always possible. But um, yeah, I think there's multiple pathways to careers, and everyone's on their own timeline. Could go on and on about this at any point, but um, uh, yeah. So I started working in sales. If you knew me, I think no one would expect me to be as much of a salesperson. I'm not the most outgoing person, but I was actually pretty good at it. And did I had no intentions of making it a long term career. It was just something to do, something to get experience with, and yeah, it brought me to it fortunately brought me to Orlando, Florida, which is where I think was very beneficial for me to then when I decided to go into healthcare and then subsequently decided to be a nurse. One of the best things in my favor was the school I had access to in Orlando. Was a small, it's a state school, but it's, one of the top, if not, I would be biased and say the top nursing school in the state of Florida, I think. But it was an associate's degree program initially, with good partnerships with local universities, to go beyond that. And then I also gave me access to the health system in Orlando Health. And I think looking back with hindsight now, those two things really are in my favor because one, I got to go to a great school that was very focused on clinical application and really getting that experience of working at the bedside. And two, I got to work for Orlando Health, which I think really set me up for success. I had a somewhat rare opportunity, I think, in today's world with post pandemic. It's a little more common that for the lack of nursing staff, that new nurses can make their way into the ICU setting, critical care right away. That's wasn't always the case, but I had that opportunity. I was given that opportunity after working as one, I said transporter. And then while I was in nursing school, I worked as a clinical technician. So the assistant essentially to the nurses on a step down unit, and was fortunate enough in that hospital to get to know, the manager and the leaders of the ICU. And they gave me a chance. They gave me a chance right out of nursing school to be an ICU nurse. And I never looked back. And that is where I spent my bedside career, was in the ICU, in a medical ICU primarily. Loved it. That is where clinically I think my passion still is. I find myself drawn back to all things critical care at different points in time. But yeah, that is how I see the sales kind of benefited me just for the sake of getting me to the location that got me in front of that right school and the right hospital system.
Yeah, for sure. I mean, I think it really goes to show that just small little things here and there, small factors will kind of lead you to where you need to be, right? That's kind of just, even if, a lot of people think that you got to take that straight road to get exactly where you're going to be, but 99% of us, like, that doesn't happen. Like, I thought I was going to be a teacher for 5 years. Now I'm sitting interviewing someone now on podcast. So who knows what's going to happen, right? Okay, so building off that a little bit. So why don't you tell me a little bit about what that was actually like, being an ICU nurse? Like, what was the overall day to day like? How did that affect your perspective on the medical care system? And just all of that. Like, what was that experience like? What did you get? What did you take from it? What was it like in the moment?
That was a big question. Let's see. What is it like being an ICU nurse? It's exciting in one hand, and equally as like not mind numbing, but it requires a great deal of patience. It is not a constant, just frantic craziness that might sometimes be portrayed on television. Um, it really is the right place for folks that want to, one, have an appetite to take care of the sickest of the sick in any hospital. And I'm not here to get into the, oh, whose hospital has the sickest patients in the world. There's no answer to that. Everyone has sick patients and everyone cares for their patients. But in each and every hospital, you will find, hopefully, you should find the sickest patients in the ICU. So, one, you need to be there for the right reason, there to take care of the most critically ill patients, and not there because you want your patients sedated or you want your patients to not be able to talk to you, or you think it's going to be some like adrenaline junkie experience. That's not the right thing to do, because it's not that. It is very much at the bedside, 12 plus hours a day, caring for 1 to 2 patients in a very intimate way, and really truly holding their lives in your hands oftentimes, and trying to get them the best outcome and working collaboratively. I honestly, what I wanted to do and why I wanted to go in the ICU is because I wanted to be a total care nurse. And I think that having been the nursing assistant before, a clinical technician, which is a wonderful experience and a very, very hard and very, very low paying role that I wish all my nurses and CNAs and clinical technicians could get a major raise. But having that experience, I wanted to kind of take that with me. I think what was unique about the ICU is, at least where I was, there wasn't nearly the clinical technician support in the ICU, because it was a total care model in critical care, where the nurse is really, that patient is so critically ill that you are ultimately responsible for every aspect of care. And that's what I wanted to do. And that's why I did it. And I loved it. And I didn't love it every day. There were definitely days that were better than others and worse than others. And I, made some amazing connections and colleagues, and worked with some amazing people and physicians. And that's the other thing, the partnership in a good ICU setting, the partnership that exists between the nurses, the physicians, the respiratory therapists, the clinical technicians, has to be amazing, and it will be amazing if it's a good unit, a good functioning unit. And I had that experience for 8 years at the bedside, and wouldn't change it for anything, as far as where I got to work and the team I got to work with. And we went through ups and downs and changes and all sorts of things at the time. But that is, I think that's what I would hope most ICU nurses would tell you is the real experience, is a total care model. And what that really is really being responsible for every aspect of care, ultimately. Despite, yes, you have absolute partners, you have your respiratory therapists, you have your physical therapists, and your dietitians, and your pharmacists. And I'm going to forget someone that one of my former colleagues is going to reach out to me and give me a hard time about it. So I apologize if I'm not saying anyone right now, but that the multidisciplinary team of the ICU is really an incredible thing to be part of.
Yeah, I mean, the way that you're describing it, it kind of brings me back to memories of people talking about how their team works in like a sports setting or something, like kind of shouting out like how every member, when it comes to like the equipment managers or the coaches or the star player, the role player, like everyone's kind of got their role in it. And in order for it to be as great of an experience as you had, I'm sure that it had to all kind of work together like really, really well. And I would hope that just living life, right? I would hope that everyone has that experience, but probably pretty possible that not everyone kind of is able to be a part of such a great functioning unit like yours. But
yeah, and I think healthcare is at I don't want to call it a tipping point, but it's certainly at a fork in the road, where the pandemic exposed a lot of challenges in our healthcare system. I think many of us, especially of us who practice in it and lived it every day, knew that are there. The question is, how are they going to be addressed? And I can say, and I'm sad to say, that many people do not share my experience. That's why there are so many burnt out nurses and folks that are just ready to even leave the profession entirely, much less just leave the bedside. And again, I will not be so hypocritical to say that there's something wrong with leaving the bedside, but clearly I have left the bedside with what I'm doing now. So you have to understand that there is a career trajectory for everyone, and we should never hold anything against someone that wants to do something for themselves. But if they're being driven away from something that they love, those are two different things. And right now, we are actively seeing and have experienced the last few years people being driven away from a profession that they really are meant for and really do love. And I think that is something that we, as a nation, as an industry, have to attend to. And the old solutions are not going to continue to fix the future and current problems.
Yeah, I agree 100%. I think that COVID and the pandemic in general has kind of affected so many industries in different ways. Like some people positively because they got to work remotely, but on the flip side, like me coming from a teaching background, I can tell you that so much burnout and just so many people not wanting to adjust to it. And once they came back into the classroom, then a whole new can of worms was opened up again with the spread of germs and the lack of socialization from kids being online for like 2 years. So it was like a whole bag of things that kind of pushed me away from teaching into something else. But it happens, right? So continuing along that line, so obviously you talked about leaving the bedside to work with Kinometrix, but before we fully leave the bedside / your experiences in the hospital, like was there a specific moment that you think you experienced that led you to formulating this idea, or was there an event, or like maybe one night you were just thinking in the shower, like, man, like I got to start a company, like like from that time period?
We are if we were talking about the trajectory of my career at this point, we are still years away from Kinometrix. So after the, I think, 4 or 5 years the bedside, and again, I didn't leave it right away, obviously, because I started to take on pretty early on just kind of how I function and what I like to do was, find problems, fix them kind of idea. And I think that's just a general positive thing that you find in a lot of nurses. I kept taking on more and more kind of projects and finding myself into what is known as quality improvement or project improvement and things like that. And Orlando Health had a very robust and very high functioning shared governance model, with just kind of consists of nurse practice councils, things like that. And I was fortunate enough to kind of rise through that program where I was, leading my units, and then found myself actually leading my entire hospital's practice council and participating as far as in the whole corporate system level council. And that really showed me something another thing I had a passion for besides critical care, was improving the healthcare system and improving patient outcomes and nursing's workflow and the healthcare system in general. And that is what actually prompted me to go to grad school. And I did grad school while still practicing at the bedside as a nurse full time. Had a wonderful leader that made it possible for me to make that. It wasn't always easy to make that happen for my schedule to be able to do so. But I went to grad school with the idea that I would, learn what I needed to learn, get the master's credentials behind my name, and parlay that into something that would allow me to, move forward in some sort of leadership or quality improvement role. I also knew at that time that I was, for personal reasons of, my partner and her career opportunities, we were going to leave Orlando. And so that worked out timing wise that I was able to, start looking for roles coming towards the end of graduating, finish my master's. And we found ourselves with a short list of places that would work for her career. Because I think, one of the benefits of being a nurse is you can work most places. There's a lot of need for them. And so we were down to the Washington, D.C. region or out west, and ultimately landed on Washington, D.C. region. And so I moved to Northern Virginia and started working with the Inova Health System as a quality and patient safety consultant. And really then kind of accelerated into that world of, stepping away from the bedside and being just wholly focused on quality improvement, improving patient outcomes, working with the frontline nurses and physicians and leaders, and diving into that. And did that for 2 years, and then took a role again still with Inova for the whole system, going back into my first love, which is critical care, as a program leader for all of critical care nursing for the system to kind of bring all the ICUs together. This was shortly before the pandemic started, so great timing for me, of course. So that kind of really turned on its head what the role was originally going to be, and my focus for the 3 years became, mostly managing, practice changes kind of prompted by COVID and the pandemic, and really trying to focus on improving outcomes while dealing with what we are dealing with, which is burnt out, stressed, nursing staff, and trying to reduce their workload at the same time of improving outcomes. And that is Inova, where I found my way into what is now Kinometrix. Inova briefly had just started an accelerator for early stage healthcare companies. And one of those companies was the original version of Kinometrix, where they had developed, it was the original kind of founders at the time had developed a device that was measuring patients' movements in three dimensions, essentially. And they intended it to be used for rehabilitation, physical therapy, things like that. That really wasn't as successful as they hoped. They realized that pretty early on in the accelerator program. And so myself, as the patient safety consultant at the time, was brought to them to kind of work with them on a research study to take their data side of things and apply it to something very near and dear to nurses' hearts and healthcare professionals' hearts, which is patient harm events. And we started with patient falls, with the idea taking, if we could do a better job of using data in real time to identify patients who were at risk for harm events, it would alleviate some of the burden on the nurses and, use their assessments for good. And that is honestly where I first interacted with Kinometrix, to the point where that kind of just kept snowballing, and I stayed involved even after the accelerator closed down during the pandemic. Still kept working on that project to make sure we saw it through, co-developed what ultimately became what today is Kinometrix's first product, which is our fall risk assessment solution. And eventually, when the pandemic had passed, and I had really been working in my role for over 4 years at this point, with the program management, decided it was time that I either needed to make the jump and become a true entrepreneur, with my colleague Davina, our CEO now, or I was never going to do it. I was just going to stay in the hospital system, in the nursing. And I decided, I wanted to try this. It was the right time, where things were professionally for me, that it made sense to make the jump. And so now I can say that I'm a nurse entrepreneur. And if you could tell from my entire story, it just kind of happened. Like it wasn't like I planned it. I didn't, go to grad school with this in mind at all. I went to grad school with the idea that I wanted to focus on process improvement, quality improvement. But I think there's so much opportunity to improve the healthcare system. And sometimes there's, startups have an opportunity to do that with the right mindset, the right frame of mind, that they can really disrupt in a positive way the healthcare system, in little bits, and really make a positive impact on patient lives, on nurses' lives, on clinicians' lives in general.
Yeah, definitely. I mean, sounds just like one thing happening like after another, right? Like I'm sure. Like, was there at any point during your time at Inova where you felt like, because you said that the project itself was kind of starting around 4 or 5 years ago. Is that right? What turned into Kinometrix originally?
2018 was
2018.
around that time, was when they kind of joined the accelerator. And then I mean, these things take time to get off the grounds. They really truly, they kind of came in the accelerator late 2018. We all know when the pandemic really kicked off, which was very early 2020. So you have that kind of year window where I was working with them on what was a research project at the time to develop this model that could better identify fall risk. And then the pandemic happened, the accelerator kind of closed down, but that project was still, to me, worthwhile doing. I stayed with it as the primary investigator on Innova's behalf. And yeah, I think after the pandemic, can we really say it's finished? I guess it's over now. The public health emergency's ended, so there's that. That really it had that point had really grown legs, and they were raising money, and I was actively working with them as their consultant for all clinical issues, and truly was the co-founder of the product and the project now. And as the co-founder, I was told by my dear friend and co-founder and now our CEO that she would kind of nudge me every once in a while and say, when are you going to come on full time? We have enough work to be doing. Stop trying to do two jobs at once. And I finally did it. So here we are.
Yeah, like so. Do you feel at this point you've been full time with it for, I'm looking at it, like a couple months since February? Is that right?
Yeah, February 6th was when I officially left Innova after 7 years with them. And yeah, I've been completely focused on Kinometrix since that time. And it's been so interesting and so different to not have this kind of as like I would do all my work with Innova and will put in a lot of work there, and then come home and either spend a day on the weekend or my evenings, meeting with potential investors or talking to potential customers and things like that with Kinometrix, to really just be able to put all of my effort into this. And it's been, wonderful to see what we've been able to do in this short time.
Yeah, definitely. Do you feel like taking on that responsibility, kind of putting all of your efforts into this one lane, have kind of affected how you approach things? Because I find that if you're committing to something like building an entire company, like I feel like the pressure must feel like it's much more moved onto your shoulders, right? Like, do you feel, have you felt like a significant, like emotional or responsibility shift over the past couple months? Was there
I
like
mean,
a
I definitely
tipping
truly
point?
feel like an owner now and a co-founder. And before, they would tell me like, yeah, you actually really did develop this. This works. This is, and that was nice to hear. It was kind of like a, ooh, yay, kind of a badge, if you will. Now it's truly like, wow, I really did co-found this company. But aside from that, and this is an interesting thing, and people may, disagree with me or take offense, and I apologize to anyone out there that disagrees, is when you do when you are a nurse, that is a high pressure job. That is a bedside nurse, and in all the work that I've done, been a bedside nurse, been, if you take my healthcare career, um, been a quality improvement patient safety professional that was, responsible for doing reviews of very serious harm events that were very unfortunate, things like that. Moving on to the leadership role across the system for supporting all the ICU nurses in a large hospital system, to now being a co-founder and chief clinical officer. Hands down, the most responsibility I've ever felt was at the bedside of a patient. And I think that's hard for folks that haven't been in that kind of position to understand, when they're like, aren't you really scared? Aren't you nervous? I'm like, no one's dying on me. Like, I am not responsible for any individual life. Businesses are businesses, but they should never be seen as, as valuable as a human life. And I'd say that knowing full well that I have full responsibility for this. As we bring employees on board, I will be responsible for their well-being as we grow our team. And I take that very seriously. But as far as what stresses me, it just won't compare. I hope it never compares, I should say, to actually sitting at the bedside of someone and having that responsibility. And I it's so funny that I have so many young nurse that young nurses that I work with, not young, like young in the career. Let me clarify that take 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 that on. Not, I don't want to paint the wrong picture or anything. Take on this role and take on this responsibility, and sometimes they are very young, like in their early 20s, and they're taking on the role of a bedside nurse. I don't even think that they comprehend like what responsibility they have, because then it'll come down to like presenting on stage a project they did, and you'll see like the look of terror in their eyes that they have to go talk in front of a group of people, and they get very annoyed with me. I'm like, why are you nervous? No one is dying. Like, you do the hard part every day. Just go up there and talk. What's the worst thing that could possibly happen? You mess up. If you mess up there, nothing bad happens. If you mess up at the bedside, that's when you guys, like, I trust you at the bedside. I trust you to go up there and present your work. And so I think, a little bit different in that. And that I appreciate you pointing out that I have the responsibility of the company, and I fully agree. But it just is, it's not the same as, I hope to never find that to be as stressful as, what I used to do.
Yeah, I mean, I think you illustrated that pretty beautifully in terms of just it's all about perspective, right? I think that when people do something and most people's jobs aren't like centered around having other people's lives in their hands, they have like a different level of connection with that, right? And the amount of importance that they actually put on them. But when it comes down to it, right, like the people who are actually out there saving lives and the people that can really process that in a way where they understand the weight of responsibility they have, then that really changes everything from that point. Like everything kind of feels a little less important or a little less impactful or stressful than it originally was. So I guess that just means that you're great at your job, like I'm sure like not everybody can fully does it, right? It's like you either care a lot and you're good at it, or you don't care, and then you're able to live a much more less emotionally impacted life from it. But why don't we talk about like flip it around a little bit? So we're kind of talking about the stresses about the two professions. Why don't we talk about the fulfillment that you're getting out of it? So I'm sure that's very different as well.
It is very different, and I'm glad you brought that up, because I think I struggle with this. I thought I would be at the bedside. I was just going to be a bedside nurse. I loved it. I was just going to do it. And then I kind of found my way, like I described already, down this trajectory that I did not plan. And I do get asked, and I have been asked by, again, some of, newer nurses, or, nurses that at a kind of a crossroads in their own careers, trying to understand how do they, make that change. And I think, unfortunately, it's kind of this, sometimes there is a perception that you're giving up if you leave the bedside, or, that somehow you're not going to be as impactful. And I get that, because you don't have the hands-on aspect of doing what I described already. But I also recognize pretty early on that if I'm an ICU nurse, I take care of two, sometimes even only one patient a shift, or a day, whatever that is, and I can have a wonderful impact on that patient's lives. And I hope that I have had positive impacts on many patients' lives in my career. But if I could, impact the nurse's workflow in a positive way, or implement some new process or system to improve outcomes across the board, well, then I just had an impact on hundreds of lives. And so I think that's what I've really come to understand and appreciate about folks that go into, leadership in nursing or clinical leadership for the right reasons, that have that kind of mentality. And I took that with me, and I had that same debate with myself, when I left the hospital system. Like, I didn't do it during the pandemic. I couldn't bring myself to do that, while we were truly in a pandemic state, to leave my role. But after kind of the dust had settled, I still had to have that kind of conversation. Am I still a real nurse? And some people will say like, "Oh, you used to be a nurse," to me. I say, "Well, I am the chief clinical officer. I am still a nurse. This is my nursing knowledge is at the forefront of what we do at Kinometrix, what we're building, how we guide the use of AI responsibly is fully rooted in like me being a nurse. And I think that is a tough perception, and I think that's hard. I think for some nurses to accept is that it's okay to not be at the bedside. You are still a nurse as long as you carry that profession with you and you use that as your guiding point. There are so many things nurses can do and should be doing, and I think it's unfortunate the amount of things that we don't see nurses getting involved in because it's sometimes a perception that that's not nursing, or that's something that you do when you're very much later in your career. And we could have such benefit from some of our, young, eager, engaged nurses with a fresh perspective to start to take on these kind of challenges within our healthcare system. One of them being, what the heck are we going to do with AI, which is what I'm do a smaller part of what I'm doing, trying to address. And because I've told some of my colleagues, fellow nurses, is this is going to change our profession. It's up to us to decide who's going to make the decisions around that. Are we going to let another profession or other professionals make those changes, or are we as nurses going to make sure that we are at the table and guiding how AI and machine learning will be used to affect our roles?
Well, you're a natural at this because that's a perfect transition into our next topic. How exactly did you get mixed up with all this AI?
Kinometrix. And again, like I said, it wasn't even really what they were intending to do. It was going to be a device, and then they had some really good data analytics things they were doing, but even that wasn't the AI machine learning. That came after looking at, well, all right, so we want to build a tool that that improves the ability to identify who is truly at risk for a harm event in hospital. Machine learning is just the tool that allows us to do that. And it was very important that we get on something like that, because otherwise, this is, again, no disrespect to any of my predecessors, colleagues, or anything like that. You go to a lot of conferences in healthcare, and there's a lot of wonderful ideas for improvements. And I've been in this boat before myself, that the implementation of it boils down to a new checklist or a new sign on the wall where something gets handwritten down or something else gets put in the chart that the nurse has to document. And I really felt like that was time to get past that we were not going to be successful if all we offered our nursing colleagues as Kinometrix was an improved assessment tool that they would then use. That was just another thing that they were going to have to do, was just going to be slightly different. AI and machine learning gave us the ability to automate it, to take the nurse's knowledge and assessment skills, because one of the most important things that we use in our models is the nursing assessment, and make use of that without having them do extra work. So, a nurse for 30 years, and I had done the math, like at some point, I wish I had it written down. I'll come prepared next time. That if I had taken care of 2 patients full time plus maybe overtime for 30 years, how many patients would I have actually ever assessed? And the number is frighteningly small compared to the number of cases that we can use in machine learning to teach these models how to do what they do. And I see that not as replacing a nurse at all, because they are only as good as the information that comes into them, but it capitalizes on the expertise of nurses and augments it in a way that makes it very useful for them, very valuable for them, and that it can take 500,000 or 1 million of their nursing assessments and look for the commonalities and look for the networks of things that we maybe subconsciously have a sense of, but with all the things going on in a nurse's day-to-day, might not really pick up on in as real time as this can alert them to, based on the information that model is getting from the chart. And so that's where AI and machine learning kind of came in. And that's where I've tried to expand my knowledge of it. So we can be very, very judicious and very responsible with how we're using it, because there's a lot of cautionary tales out there that we do not want to fall into. But at the same time, healthcare has moved so slowly. That the statistics is still out there that it takes 17 years for something to get from evidence to practice, and really want to try to be better than that this time around when it comes to AI and machine learning, because it's already out there and it's growing in the commonplace. ChatGPT, Bard, whatever those tools are, healthcare will start to adopt these, but it's always going to be slower. But it shouldn't be as slow as we've been in the past with adopting new tools to make our lives better, to make patient care better, and to improve the workflow and the experience of our clinicians.
Well, hopefully with the speed that everything is kind of happening these days, that it can start to trickle in so a little bit quicker into the actual process of how long it'll take, right? Because AI makes things quicker. Hope maybe even the processes become quicker too. But then again, change isn't always the best, right? Because if things are constantly changing, then nobody's ever going to figure out like exactly what to do at any given point in time, right? So of course there's reasons why things take so long, but maybe we can just speed that up a little bit just to kind of get the best out of the possible resources that we have today. Okay, so that's pretty much all my questions that I had today. I think we've covered a lot. So much great content in there. I'm definitely going to be chopping this up into more bite-sized pieces so people can get the most out of it. I feel inspired. I hope that other people can feel inspired too by your journey. So is there anything else that you kind of want to leave anybody with, like any words of wisdom or any advice that you want to give to anybody that might be working in nursing or anything else that they can take from your journey?
I think just be open to new experiences, be active. To all my fellow nurses out there, don't assume, or never assume, I would say, I beg you not to assume that you don't have a voice, or you shouldn't speak up because you're a nurse and not something else, be it a CEO, a physician, or otherwise. You have such valuable input to give, and we need our nurses, especially our newer nurses with fresher experiences that have been on the forefront, experienced the last 4 years, for example, firsthand. Your input is incredibly valuable. So I'm happy to, please reach out to me. I know I do not consider myself a seasoned expert nurse, but I'm more than willing and more than happy to always collaborate and discuss and mentor where I can mentor, and be mentored where I can be mentored. So I'll leave it with that.
All right. Well, that sounds like an amazing opportunity for anyone that might be listening. So please take him up on that before his DMs get completely blown up to smithereens. All right. So that's it for our first 2 episodes talking with Patrick. He's got plenty more where that came from, but that's just a little introduction into Kinometrix and also his journey leading up to this point. So I'm Brian. We'll be back next week with some more riveting discussions about Kinometrix related fields. Hopefully get another couple of guests on the other big wigs in the Kinometrix extended universe. Hopefully we can get some more people on the outside too, talking about what their companies and their ideas are bringing forth. So stay safe out there in this world. Thank you for listening. This has been episode 2, and we're signing off. See you next time.
Thank you.